invite Mr. Khawaja Naveed, Chief Vision Officer, AML. The topic of his discussion is digital diagnosis with artificial intelligence. Thank you.
It's an honor to be here. Jazakallah khair, Dr. Azfar, for inviting me. I am based in the UK, so it's quite fortunate that I've got this window. And I'm here, I'm really pleased to be amongst you. Today's topic is, in my opinion, one of the most important topics that each and every one of us needs to be concerned about. It's not a secret that some of the greatest, if not one of the greatest, in fact, the greatest challenge we have at hand is digital health, especially around breast cancer. We focused on this because of a few reasons that I'm going to share shortly. And the intention for this session is to help you understand what we have developed till now and how we can collaborate in bringing preventive health care to Pakistan and beyond, inshallah. We at Infometrics are a very purpose-oriented organization. We believe in making people wiser, insights smarter, and data cleaner everywhere, every day. And we don't just have it as words. We believe in each and every aspect of it, and we live by it on a daily basis. In every product and service that we provide across the globe, we have offices in New York, London, and Islamabad. We believe in this, and our customers verify for that. Amal, it's an Arabic word starting with alif, not ain. Alif, the Arabic word, means hope. And it is a hope for the women of Pakistan first and our neighboring countries in the near future, inshallah. It's a cancer diagnostic assistance tool that uses artificial intelligence to identify areas of cancer and the stages in less than a fraction of a second. Our aim is to improve the survival rate of breast cancer from 50% to 90% by 2025. As you might be aware, it is a very dire situation in Pakistan. Right now, the survival rate is 50% or less. The vibrant population of Pakistan, we have 221 million population, out of which 70 million are adult women, 15 years or above. Every 9th woman out of that is at risk. We have the highest breast cancer rate in Asia. And as every 9th woman is at risk or likely to develop breast cancer, we are sitting on a volcano that is ready to erupt. In 2018 alone, we had 90,000 confirmed cases, out of which around 50% of people lost their lives. And in the near future, according to WHO, this number is going to double. We need to do something about it. Amal brings all of those challenges to head, and we took it on the head, and we are proud to confirm that we have accelerated the cancer diagnosis, the breast cancer diagnosis initially, to 90% faster. We are making it affordable, reducing the cost by 85%. And the accuracy rates, which are alarming, the accuracy rates right now for breast cancer in Pakistan are less than 50%. That means a flip of a coin. Imagine your doctor says you do not have breast cancer. You go back, you live your life normally, and in a year's time, God forbid, your cancer stage reaches from stage 2 to stage 3. There is no cure. There is no way the patient will survive. It will be a miracle. So just because of misdiagnosis, we lost another life. Can you imagine that happening to you, me, or anybody else? Every 9th woman means every other household has a potential breast cancer patient. Even in my own household, I have a few examples of that. And the kind of repercussions that it brings to the family, to the patient, to the overall society, it's huge. It gives me goosebumps to understand or just to appreciate the volume or the gravity of the situation. So alhamdulillah, we have been working on this in a very agile way. We are making it accessible because more than 80% of Pakistan's population lives beyond these main cities. In the whole of Pakistan, there are only 148 pathologists. Imagine 70 million adult women, 15 years or above. Every 9th woman at risk, meaning around 8 million women at risk. How many doctors for that? 148. Very specialized skill. 52,000 patients per doctor, per pathologist. And this is again even further, histopathology is even less. So we are sorting this problem out together with big hospitals, alhamdulillah. I'll explain those shortly. Just the impact we are expecting, if we are 5% successful in our claims of what we can do, we'll be able to save 10 billion rupees per year for the common people, those who go below poverty line and never recover. We've talked about 100 million people who that happens to them on a yearly basis. We're going to save those. We're going to save more than 10,000 lives per year, inshallah, with preventive care. Some of the major institutions that we are working on and collaborating in the research and the clinical trials that are starting shortly: Shaukat Khanam, University of Lahore, Pakistan Institute of Medical Sciences, PIMS, Sheikh Zayed Hospital, and Shifa International. On various aspects, we've got digital pathology education portals. These are cloud-based solutions. And then the digital diagnosis as well. Our algorithm has been awarded multiple awards globally, and it has now been published in Computerized Medical Imaging and Graphics journal. The initial impact factor was 3.75. It has grown further now, alhamdulillah, and it has gone to 4.79. It's ever growing, ever improving as we improve our algorithm further. We were awarded the best paper in Pakistan via Comstech. We won the award from Google, TensorFlow, and we gained their funding, alhamdulillah. And working with University of Warwick. University of Warwick has the UK pathology lake, the data lake that is the central repository for all digital imaging in pathology for the UK is based in Warwick. When they saw our algorithm, when they met us, when they saw the efficacy of our solution, they offered full scholarship to all our research team at their own expense, and they asked them to come to the UK. They are still here because of COVID, but hopefully soon they'll go and work with some of these world's best organizations. In 2020 last year, in August, we were shortlisted as one of the 25 most innovative AI companies in Pakistan. And President of Pakistan, His Excellency, Dr. Ayub Alvi, visited our own stall and we explained it to them. Minister of Science and Technology was there as well. And then immediately we were invited to their offices, and alhamdulillah, some excellent progress was made then. Following up from that, we were offered a keynote and another opportunity at Comstech in AI in Healthcare conference, the first of that. And alhamdulillah, well recognized in all of those domains. Our roadmap, our proof of value and minimum viable product is ready. It is being trialed, and the clinical trials are now in place. So some are starting and some are about to start. In September, we hope to have some conclusive data on that. And by January 2022, we will have adjusted our algorithms and the feedback from the market and the ecosystem that is lacking in Pakistan. Inshallah, we'll contribute to that. And by June 2022, we'll be launching this diagnostic assistance service in full-fledged in Pakistan and getting ready for Middle East and African regions. So there are some excellent advisors. God has been generous. We have some of the top talent in the country. University of Lahore's chairman is here, rector of FAST, head of histopathology from PIMS, and non-executive directors from Bradford Teaching Hospitals, NHS, and many others, amazing people. We can't list all of them. There's a huge list, and these are all some of the top professionals in this field. The three key people who are really leading the technical advisory are the head of histopathology, Dr. Hamareen from PIMS, Islamabad, Head of Histopathology in Shaukat Khanam, Dr. Usman, and Head of Histopathology, Dr. Aman Rahman from Sheikh Zayed. And many other researchers are working with us. And out of those 148 pathologists in Pakistan, can you imagine, around 40% of those histopathologists are already with us. We have a common purpose, we have a common vision to save people's lives with technology, inshallah. Our aim, our focus, our key message for today is we believe that we should pass on the mundane to the machine and purpose to the people. When we say mundane to the machine, that means if there are, I'm sure there are so many doctors in this room, when a highly qualified doctor is asked to repeat or look at same kind of patients all day, day in, day out, or somebody has a throat ache or a headache or just common fevers, that's not the utilization of their skill. That's actually a waste of their skill. We are saying that mundane tasks should be automated, and some excellent presentations already in the room that covered these topics. But our focus is to make sure that we give purpose to the people, meaning when the mundane will be given to the machine, people can focus on what they really are passionate about. Their key purpose will be met when they explore their true passion. And that won't come with the mundane routine tasks that they have to do on a daily basis. Same goes for histopathologists, same goes for any kind of cancer care. If they have to look at day in, day out on the same kind of problems, that can be done as a standard pattern by an artificial intelligence algorithm, why are we wasting their time? So we want to save their time, save their intellect, and utilize it in something better, inshallah. And purpose, the key thing for us is, purpose is doing something that is beyond making money. Remember that. Our focus is not making money. Our focus is to make sure that we bring better health to people. We can prevent the disease, inshallah. When we have regular diagnosis, we can prevent it by collaborating with these insurance companies who will provide these as part of the package. The patients can be digitally diagnosed for cancer diagnosis, not just breast cancer, because we're working on head, neck, and colon cancer as well. So all those things coming together. And the intention is to collaborate here. I'm based in the UK. I was visiting, so alhamdulillah, it's great to be here. And before I go, which will be in a week's time, hopefully, it will be great to have a conversation with you, collaborate with you. I'm here for the rest of the day. Please make a point. It will be an honor to have a conversation with you and do this together. Okay. Jazakallah khair. Any questions?
In the absence of this policy or still the process, if we trigger all these AI-based healthcare, what do you think which can be possible ethically? Thank you. So, I think one of
the algorithms that you make for, say, diagnosis of breast cancer. So, what are the basic studies that you base your algorithms on? For instance, do you base them on the guidelines that are followed in the USA, or are they updated? How soon do you think they need to be upgraded, since the research is constantly evolving?
So the question is this a mammography-based system or not? So we are working on the pathology side for now, because in Pakistan, the infrastructure for mammographies and ultrasound is very limited right now, and the data is very limited. And one of the things that we were taught by the technical advisors was, for every mammography exposure, one mammography exposure means equivalent amount of radiation as you get in the whole year. And this is a statement by head of histopathology from PIMS. So we are concerned that mammography, yes, it does identify the lump, but it does not add, it does provide the basic diagnosis, but ultimately you have to do the pathology. You have to do the biopsy. And once you do the biopsy, we digitize that image and feed it to the AI algorithm. So ours is based on pathology for now. The second part we are doing in non-invasive is the ultrasound. So ultrasound-based, non-invasive, safe testing. and that we are working on. The product is not ready yet, so research is still in progress.
Okay, thank you. Just another question. You just mentioned 1 in 9 women are prone to breast cancer.
Yes.
So it is good to work on the effects, but are there any known reasons for the cause of this so that we can, work at the root level?
Yes, so our intention is to go from the inception, not just curing the disease, but preventing it and actually preventing it from happening as well. And that inshallah will happen. Yes, there are some dietary issues as well. Sugar causes a lot of that. And there's so many other things. It's a long list, but we can share the research with you. And we, inshallah, we'll go in that domain as well.
Islamic, this is Ammar Jafri. In West, there's a number of issues of ethical issues of AI. Right now, we're in the process of making a policy on digital health in Pakistan. So, in the absence of this policy, or we're still in the process, if we trigger all these things to AI-based healthcare, what do you think, which can be the possible health ethical issues in Pakistan?
Okay, thank you. So, I think one of the things that we have to be cautious of is AI. Many medical professionals fear from that their jobs will be taken. No, it is a diagnostic assistance tool. The intellect of a human will always be better than anything else. Allah Ta'ala's gift to those doctors who have this specialization is to find those edge cases and to always extend the kind of diagnosis that can be done. Now, AI can always help in the repeatable patterns that we already have. So it is a combination, it's an autonomation. It's not a full automation. It's not a pure nomation. It's an autonomation, meaning joining the automation with people. And the specialization of the doctor, finding those edge cases, working with the technology, and policies need to be thought through like that. Because if you just make a policy of automated diagnosis, that might not be the right thing to say, because this is diagnostic assistance. And globally, we know if an AI algorithm finds a root cause and gives you a diagnosis, for example, in the US, and the diagnosis is incorrect for some reason, who would you sue? Where is that single ringable neck? Would it be a doctor who signed over it? Would it be an institution who signed for it? Or would you pick up and grab the AI algorithm itself? So those kind of considerations are there. It's a longer discussion. We can have a follow-up conversation on that, but Jazakallah khair for the question. Yes.
Assalamu alaikum. So I'd like to ask you, the algorithms that you make for, say, the diagnosis of breast cancer. So what are the basic studies that you base your algorithms on? For instance, do you base them on the guidelines that that are followed in the USA, or or are they updated? How soon do you think they need to be upgraded, since the research is constantly evolving?
Okay, great question. Jazakallah khair. So I'll give you a shorter version now, and we can have a longer conversation in the break. The simple answer is, all the research that we did initially was based on the UK-based standard data, because it was a competition and we won that competition by identifying the right patterns. This is a never-ending task. It will continue forever, inshallah. The specialization of the doctors, any patterns that they find are repeatable, will feed it to the AI. That's the background activity that will continue forever. But for the rollout, imagine a good histopathologist, an experienced one, let's say 20 years of experience, they would have seen hundreds of thousands of these cases, right? They have got a mental model that they can refer to and find those patterns and recognize whether somebody has cancer or not. Once they get older, yes, the experience is increasing, but the memory is impacted as well. And over time, when it comes to the retirement age, what would happen? We lose all that skill to somebody very young. We are saying our algorithm, AI-based, will keep on learning, will never retire, and doesn't get tired. And one of the biggest issues with cancer diagnosis is when you're looking under a microscope and looking at a biopsy, if you are tired, if you didn't have a good night's sleep, if you fought with your neighbor on the way, or you had a bad traffic experience, it has an impact on the diagnosis that you've just done. So there are emotional connections to it as well. Our AI is very neutral, and the algorithm is ever improving. And if there are patterns that are no more relevant, we remove them as well. So it's always positive and reducing the negativity. And inshallah, over time, it will be the